Hi, I'm Kathleen Johnson, and I'm a volunteer on the Survivors Council of Advocates for Opioid Recovery. And I'm going to bring a little bit of the on-the-ground, in-the-trenches perspective of a co-survivor. About 10 years ago, my husband and I were in the kitchen trying to figure out where all the spoons had gone. And it took a couple days for us to finally put together that our son was addicted to heroin. And in that moment, there's the shock and the dismay and frankly, horror. What do you do? And I did not think that 10 years later, I'd be still talking about this and still living this. And that speaks directly to the chronic nature of this epidemic and how much it's affecting families. So today, my son, who's 33, is in recovery, but there are ups and downs, and he was able to achieve some semblance of recovery through methadone. And he tried many things, many treatment centers, many approaches. He was incarcerated. He has been homeless. We have shipped him all over the country. We have kicked him out. We have brought him in. Today, he is married, he is working, he is supporting not only his family, but his stepdaughters, whose own father died about a year ago of an overdose about 2 days after he was released from jail. So my journey, though, is not his journey, and it would be presumptuous to say that. It would be presumptuous for me to try and explain the life of someone who is living addiction. But at the same time, the reason I'm here, the reason I'm working with AOR is because I look around at our friends, our community, his friends, and I see the destruction and the stress on the infrastructure of everyone's lives. Because it's a wonderful segue to talk about bringing the addicts in and talking to them, but most of them are just trying to keep their head above water. You know, many people, they're trying to get to work every day. My son's greatest challenge is to get to the methadone clinic in the morning at 5:30, right when it opens, so that he can be first in line, so that he can get to work. And that he can work and he can get home, and they can do childcare for 4 children, and that they can keep the roof over their head. And for the first year that he was in the methadone treatment program, my husband got up at 5 o'clock every morning to drive him to the clinic so that he could get there, so that he could get his driver's license back, because of course you lose your driver's license, you lose your ability to transport yourself. And so the concern that I have, and I think that's so important about the education and the structures that we set up, are that they look at the fact that this is now just a multi-generational, decades-long challenge that families are facing, and not only families, but employers, the communities. It is everywhere in terms of, I think about the challenges for the school systems, for those teachers that had to talk to my granddaughters in the days after they went back to school after their father had overdosed. And so there's a larger challenge with integrating what we can bring together and help not only the people who are trying to be in recovery, but also the families and the structures around them. Because at the same time, you're not trying to enable or be codependent or overhelp somebody. Your own life is being impacted in ways, what's right, what's wrong. I mean, I'll be honest, this past weekend, my husband and I had to have a heart-to-heart about going back to counseling to think about, okay, here we are, it's 10 years later, there's ups, there's downs. How do we cope with this? How do we keep our normalcy? I would just close, it's interesting to me because I've heard a lot of people draw parallels to type 1 diabetes. I have a granddaughter that was diagnosed, she's 9 now, she was diagnosed 3 years ago with type 1 diabetes. I remember at the hospital that weekend, they said to us, well, this is your new normal, it'll be fine. It's not a new normal, and neither is living with someone and living with this opioid epidemic. You can try to normalize it. Sometimes that's good, sometimes that's bad. And so the important part is to have an approach and thinking about what are the pieces that we can bring for the families, for educators, for the school systems, for, again, our law enforcement and everybody that has to have both a personal and a professional perspective on this that's consistent. Thank you.